What's up?
Hi there.
How are you?
I'm good. I'm good. And you?
Doing all right. Yeah, probably better than I deserve, you know? So, doing okay.
That's not bad. That's not
Yeah,
bad.
yeah. Complaining wouldn't do me any good anyway. So,
Right. Oh, we've
uh,
got some people coming in.
nice. Hey, Ebony.
Hello.
How are
How are
you?
you? Good.
Yeah.
Good.
Y'all
Getting
have
through.
anybody have plans for the Memorial Day weekend?
Yeah, I have going to Eugene for my father-in-law's birthday, and then Sunday I have a barbecue to go to.
Classic Memorial Day.
So, yeah.
Yeah,
What
nice.
about you?
Oh yeah, I go over to Eastern Oregon with 20 to 30 family members every year and
Nice.
go work. And yeah, we're gonna, so we've got our projects for the weekend. And
Nice.
yeah, so that's good. Like my brother, his family, cousins, all that sort of stuff. So yeah.
Awesome.
Yeah. What about other folks? Any Memorial Day plans? Unofficial start of summer?
Kind of normal weekend stuff.
Uh, Nobody? Leah, no? Adam, no? You're not like doing a run or something, Adam?
Doing
You're
stuff.
everywhere, man.
I'm doing the following weekend, not the actual Memorial Day, but like after.
What are you doing after, Leah?
I'm going to Brandy Carlisle in the Gorge.
Nice. I was looking at the Bend shows, but not you're going all the way up to the gorge. Okay. Nice. I have some good memories of Dave Matthews Band at the Gorge. He plays every Labor Day weekend, 3 days of concerts. When I was young, we had like a whole crew that went every year to Dave Matthews on Labor Day weekend. Yeah.
Those were the best.
Throwing glow sticks in the air, you
Loved those
know.
concerts. Those were the absolute,
Oh,
they were the best.
yeah.
Yes, I recall. I'm not young enough for Dave Matthews style.
Yeah. I
Yeah,
don't
but
listen to Dave Matthews generally, but that that's a
oh
concert to go to.
yeah, I was a big fan.
Yeah.
Big fan. Yeah. I'm more in the Brandy Carlisle easy,
Yeah. Different kind of party at Randy.
very
Yeah.
different.
Yeah. Been a few years since I made it up to one of those. So I'll leave it at that. Yeah.
I just saw Bush when they came to the Rose Garden, and they sold so few tickets that my buddy and I were supposed to be in the 300 level. We were moved up to first row 100 level. Like there was no like the entire 300 level was closed. I have never seen the Rose Garden so empty, and the show was very bad. Like new Bush is really bad. Like old Bush was like the classics. They also didn't really have any energy to play them, so it was one of the worst concerts I've ever been to.
That's
Come
disappointing.
I
coming
know.
to a county fair near you. Yeah. Yeah. I will say though, the Oregon State Fair, they have some shows this year, guys. They got Big X the Plug to come, which like I feel like yeah, like exactly, right? Like usually they're like got a rapper that's been washed for 20 years.
Well,
That
I went to what was the one not last year, the year before. What's his name?
was like
Ludacris at the
Luda,
fair.
yeah.
It was
See,
awesome that I only paid $25 and I
Yeah.
felt so old. But I was like,
Hey, Ludacris is timeless. He never gets washed up.
Ludacris is timeless. Like as long as he's got that energy still, like yeah, yeah, that's true.
can I just
But
say I went to the Rick Ross Organ Symphony the other weekend.
oh,
It was like different.
was it
So
good?
proud of myself. It was good. I would do
Yeah,
it
okay.
again.
Yeah. There was I had tickets to Cypress Hill when they did that with the
Mm,
Oregon Symphony, but I ended up being out of town, so I gave them away, so I didn't go. But I've been wanting to make one of those. So
it was fun.
nice. Anyway, sorry, you can get us in order. I was just asking people what they were doing this weekend.
Okay.
Yeah, we got rolling a little bit.
All right, Anna, do you want to kick us off, or how do we want to start this?
We're in exec, right? I'm trying to get the slide to show. It's not showing up. Okay, here we go. From whatever, from beginning. So we've decided that we're supposed to sit when we're doing those little chatty bits at the beginning with our group agreements pulled up and because the new values, they say advance equity by promoting accessibility, affordability, and quality, and they link to the equity tool. But we don't have that, like, our commitment to racial equity sort of leading anymore, and it felt a little bit, I don't know, like we had taken a step back. We staff were like, what if we do it this way? So here is our first, well, we kind of did it in somebody's investments and finance, but we didn't read this out loud. But I do think it would be helpful if we would. So SOCAC acknowledges the harm and systemic oppression of historically marginalized groups at the hands of Oregon's governmental institutions and system partners. These systems include education, child welfare, criminal justice, health and disability services, and other systems where overrepresentation of marginalized populations exist. Of particular concern are Black and Brown families of historically marginalized communities, LGBTQ plus youth, and tribal children and families. Just to sort of ground ourselves in what we are here to do and maintain the sort of intersectionality focus that we committed to and then maybe haven't maintained as much laser focus on as we should have. So our group agreements: be present and participate to the best of our ability. Treat others with respect. Avoid interrupting and using the name and show them that you respect them by using their names and pronouns that they prefer. Avoid acronyms. Use the chat. Varied opposing ideas are welcome. Be curious when disagreement occurs. Honor those with quieter voices. Lean in or lean back. Avoid problem solving for individual situations. Connect offline if and when possible. Focus on our purpose, improving the system of care for Oregon. Be mindful of power dynamics and do your best to avoid harming others. Be open to repairing any harm you may cause. I'm going to let the other two folks who were knocking on the door in, and then I'm going to put the agenda up. We have a couple of updates from staff. Oh, wait, sorry, I forgot. We also have a little quorum check here. These are the members of our voting members of our executive committee. So Ebony's here, Leah's here, Adam's here. Andrew, are you here? I don't see Andrew. Jackie's excused. Jasit is here. Adam Peterson is here. Zafir is here? Yeah? No, Jasit is here. Zafir is not. Sorry. Dan Thomas here. Allison Stark is here. Anderson is here. Annette is here. And we are waiting for the REAP peer support specialist to join us, which we will talk more about soon. And as soon as this document opens up, you have a question? Yeah.
Vanessa's Read AI notes or anything? Like, do we have a policy on? Oh, did we kick him out already?
Somebody did, yeah.
Okay. Yeah, okay. I was like, do we allow those? Just because I don't know who Vanessa is, so.
Vanessa is our Family Advisory Committee support contractor.
Oh, okay. Gotcha.
I don't know why I can't get the agenda to open up. Is Corinna here? Corinna, can you possibly open the agenda and share it?
Yeah. Give me just a
Are you a
second.
co-host?
I am.
There's Zafir. I swear I saw him.
Let me move this.
Adam, are you back? Oh yeah, you're back at home. Did you
Yeah.
have a nice time in Salem today?
Yeah, I did. It was an adventure, as always, in the capital.
I'm excited to hear more about it. Okay, so we did the exec committee intro slides. They're linked there so that anyone who's hosting can kind of pull up those two slides that I just showed you. We have a review of the March financials for 10-ish minutes. They are attached to your calendar invitation. And I don't know why they're not opening. Open in the desktop app. Please open. I don't know why this is so hard. Let me try a different way. Open. Andrew's here now.
And I think I can do it from here.
And Zephyr is also here now.
Thanks. Thanks, Dan. Welcome, Zephyr.
Hello.
So we just are finishing, we're just getting to our financial report. And so this is the report that is only through the end of March. So note that we are almost 2 months away from this, but this is sort of like the timeliness that it takes for them to like clear everything up. So the first section is what we have in our budget. The second section is what we have expended to date. So we have spent so far 2.5 million of our 8.2 million. Corinne, if you can scroll down just a little bit further. There you'll see at the bottom where it says total budget on the left-hand side, and then expended to date $2,505,790. And then if you'll scroll down a little bit more, we are projected based on current rate of spending and the dollar amounts in our grants and contracts. So when we write a grant or contract, it has what's called an NTE, which is a not to exceed amount. And they just take the top amount of that NTE. And so we're projecting to spend 7.3 million of our 8.2 million, leaving us, if you'll scroll down a little bit further, Corinna, with a balance of $873,000, and $783 on top of that. So that assumes that our stipends and reimbursements continue to go out at the same rate. It assumes that we spend the full amount on interpretation and translation, which we probably will. And it still leaves us with $873,000. So I offered to spend some more of that money on other things that have not shown up yet in this budget report. And then it turns out that this is not the money, the budget, the salary money that I thought was separate. This 873 are things that we can spend on other stuff, but the risk we take is that we come in over budget on stipends, or we come in over budget on reimbursements to SOCAC members for travel or training or whatever, and we end up with a deficit. So, happy to answer questions. I don't know, Corinna, if you want to scroll down a little bit further to, oh, Heather's here too. This is just the month-by-month breakdown. So you can kind of see where different things were coming from. And then what they do is just take this 3-month average and apply it to the future and say, if we maintain spending at the same rates, here's what things will look like at the end of the biennium. So with that context, questions, comments, fears, confusions? Cool. Well, then we can move on, and we are now 2 minutes ahead of schedule. And oh, were you going to say something, Andrew?
That's a lot of numbers. A lot of numbers real fast. But I did get.
You do have it in your agenda and your calendar invitation. So if you're the kind of person that likes to really dig in, feel free to pore over it, and we can discuss it by email one-on-one, or we can discuss it as a group in this committee or in the Investments and Finance Committee that Dan and Allison are chairing.
Yeah, Anna, this is Christy. I was going to jump in. Could you talk a little bit about how the balance here is different than the balance that we talked about at the committee, which was basically that there was no outstanding balance?
Yeah, so the balance that we have here is assuming we are underspending things that we have allocated funds for because of how the spending is the rate at which the spending is happening in those categories. So it assumes that we are underspending on things like salaries, which we are, because we haven't paid the PA3 comms person, since that position was approved and funded in 2025. And we haven't paid as nearly as much in stipends and reimbursements to committee members because we haven't had very many committee meetings. So the $873 or $873,000 balance is money that has been budgeted but is projected to be underspent in the budget.
Okay, got it. That's super helpful. I guess maybe a question for this committee is at what point would we want to, I guess, kind of like rebalance the budget and assume that we'll have unspent funds and determine if and what we want to do with those dollars, like a reallocation.
Okay, that might be something we talk about down the road. I think I mean, if y'all want to talk about it now, that's not really on the agenda, so we would be taking time from our existing agenda items. I see a question from Allison.
I don't know if it's a question, but you asked for feedback. And so I guess I would say, or questions, or I don't know, you elicited feedback from us. I think that what I will say is that I might feel a little whiplash, like we had money, we don't have money, now we might have money. And so I think I'm getting my brain wrapped around it a little bit. I think where for me it comes down to is, yes, it's amazing to have extra money. Yes, you of course would want to have that money working for you, so to speak, like as in invested, given out, those kinds of things. But I think that there's also balancing that with, to your point, going over budget potentially, as well as the bandwidth to actually do that in a very quick turnaround. So I guess from my perspective, if you were to come to us and say, this is what I would really like to do with $500,000, I think that would be a way easier to be able to say yes or no than kind of an open-ended one, because it just feels like there's a lot of variables and a lot of this comes down to your bandwidth and your team's bandwidth to actually administer this in a very short turnaround.
That's such great feedback, Allison. Thank you. And I'm writing it down as. Okay, you would, and just so that I'm clear, I mean, AI is probably tracking us anyways, but what I wrote down was that we may be experiencing some budget whiplash, which is totally understandable, and that a way to decide, once we sort of, things have settled a little bit and we know what the overage is really going to look like, if staff could come with a specific proposal that we have the bandwidth to actually carry out as a recommendation to the exec, that would feel probably the most doable way to manage that unspent.
Yes, because I don't want to suggest something that you guys don't have the ability to do.
Yeah. That makes perfect sense. I really appreciate that. That's so practical, Allison. It's like you've been a leader for a long time. Anyone else have comments or questions? Okay. So, and then the next part of the agenda is just kind of reporting out, like, here's where we're at, here's what we're doing with our committees, and how this might inform our full council meeting, which is coming up on June 2nd. So, and we had put facilitated by Adamar. Adamar, you are welcome to do this, or I can do it, whatever you prefer. I don't know why we did that.
Well, I thought you had to be like on the road or something to be somewhere, I think is why I was supposed to be doing it.
Yeah.
So go for
it. Maybe. I don't know. Okay.
If you're not going there, go for it.
Oh yeah, I was supposed to be traveling and then I bailed. Story of my life. Okay, so investments in finance, Dan and Allison. Or Christy, whoever wants to go.
All right, I can kick us off. Well, I think we just saw an example of why I am so pleased that we have Allison as our co-chair of the Investment and Finance Committee, bringing clarity and good sense to things. So that's like the big thing for me. We had our second meeting on Monday of this week. We approved our charter. We walked through SOCAC's budget, including well, basically the kind of the whole pie, but spent a fair amount of time on the local and tribal grants and how that works. And then there are a couple of the big things sort of on our docket for the year. One is that we'll be contracting with Portland State University to do a study of how the local and tribal grants are working. So like, what's the money being used for? Is there good accountability for it? Is it being allocated fairly? What kind of results are we getting for it to help us look at whether we want to continue doing the grants in the same way that we have been doing, or whether we want to do them differently. And notably, I think since we started making these grants, it's been $200,000 to each entity. And some of those entities are much larger than others, and some are much smaller. So that's one possible thing to be looked at. Anything else anybody wants to say about the budget discussion we had? So the other big thing on our docket is we are gearing up for a big fiscal assessment of the system of care. There's a request for proposal that's being developed, and will probably be released. My sense is like maybe in a month or so. I'm not sure if I've got that quite right. For a contractor to complete this assessment for us. And we want to look at like key financial inputs to the system, what's coming, what monies are coming from where, from the feds, from the state, from private sources, whatever, going towards what services, and then what kind of outcomes are we getting for those. And we're hoping for a contractor also to give us recommendations about how money might be directed, blended, braided, spent more effectively than what is happening currently. And that's all the news that I have to report. Feel free, anybody, to jump in with what I've missed or gotten wrong.
Thumbs up from Allison. Corinne, I think it's okay if we pull this down and we can just chat the committee reports into the chat so that we can see more faces. I feel like it's better. I did finally get the agenda to open up. I don't know what is wrong with my computer. See if I can copy and paste. Control C, chat, Control V. Hooray. Okay. And Adam is at 4:45. Christy says, great job. Okay. The only other thing that I would say about the investments in finance and that the fiscal assessment or fiscal analysis is that my expectation is that some of what is learned in that will go, like obviously the investments in finance committee will review it, but also I'm hoping that it can help inform some of the conversations in the data and evaluation space around how we're counting things and if we're counting the right things to be able to be ready for braided and blended funding. And Cody, I know that that is a conversation that you all sort of barely started in the data and evaluation space. So maybe we skip program and policy for now and we talk a little bit about the D&E updates. So that is Cody, Andrew, and who is your...
Jackie is our other.
And Jackie, which is...
Andrew and Jackie had to miss. So Andrew, I'm assuming you're okay with me taking the update here.
Yeah, like I'm obviously killing it as chair. Just happened to be on it. I was out of state doing something I couldn't reschedule. So please do, Cody.
No problem. We had some really good discussion in our data and evaluation meeting last month. We ratified our charter. We made some updates to our attendees and committee members. And then we kind of went through our 2026 items for completion and gave like some status updates and got feedback on all of those. And that includes our updates to our system of care data dashboard, our cross-system data integration activities and projects, Yukon Care Pathways analysis, and then I think one more project that I cannot remember off the top of my head, but all of our 2026 items for completion.
Yeah, there's a
So we got-
cross-system data sharing, Real D, local system of care, and care pathways.
Perfect. LSAC coordination was the one that I spaced on briefly, but so we had some good discussion on that, and then that was our pretty much whole meeting.
One of the things that came up in that meeting, though, was about that cross-system data sharing, and one of the ideas that came up from Chris Kahn, not to be confused with Chris Kuhn. Sam Kahn, thank you. Was to invite the chief data officer from the Department of Administrative Services, so like the chief data officer for the state of Oregon, to come in and talk about a pilot that is being done between DHS, I think it's Child Welfare, and the Office of Housing and Community Services around houselessness in children, and how some of the they have like an MOU, memorandum of understanding, that they are trying to figure out how to do better data sharing between the housing system and the child welfare system, so that they're like able to share good information back and forth with one another, and then thinking about where would maybe be the next version of that. What they called it, like a test case or something, to try to figure out, like, if we were going to add one more place that we're trying to align how we're counting and how we're defining the terms, what would that look like? So that's a cool conversation that might be coming in, and that's the conversation that I think might make sense to kind of inform with this fiscal analysis if the timing all works out. Because if you'll remember, those of you who were here 2 years ago, that intern that did that very cool fiscal analysis paper that we actually never published, his name was Isaiah. That was sort of his key finding, was that the biggest barrier in Oregon to cross-system data sharing is common definitions of how things are counted and measured across systems. And since we don't have those, we can't share data in a way that we're, to use Hillary's term, it's more like apples and cars as opposed to apples and oranges. So we've got to operationalize some of those terms before we can start sharing data. And Adam Peterson is volunteering to participate in that work. So that's awesome.
Yeah, we've just did this big data project of doing homeless management information system data with Medicaid claims data. And it's really interesting stuff. But yeah, it's apples to pineapples, and trying to create the systems that are able to talk to each other, even determining Cody Welty in one system is Cody Welty in a different system is an entirely big process. So it's something like, yeah, I'd love to be a part of that that conversation, because we're actively doing it with all 3 of our counties now with the HMIS data, which is really cool. But it's like, I'd love to be more engaged with this kids conversation.
Awesome. That's great. Cody, I'm going to ask you to keep track of that so that when we get there, we can make sure Adam is invited.
Yeah, Adam, this is closer towards the fall, most likely. We want to make sure they're more up and running, but I'll put a little note too.
And it may be a work group. We talked about maybe a shared work group between investments in finance and data and evaluation, because it kind of pulls from the skill sets of both spaces. And related, Christy put in the chat that she would like to talk about the System of Care Infrastructure Survey, and that also lends itself potentially to a shared work group between data and evaluation, and in this case, program and policy.
All right.
Christy?
Yeah, I can jump in real quick here. Sorry, I'm taking a kid to soccer. So last year, out of the data and evaluation, or it was the data committee at that point, we looked at a national survey that NTEC, the National Training and Technical Assistance Center, had developed that assesses the implementation of the system of care approach in either states or counties. And we got kind of recommendation from the data committee to go ahead and use this survey instrument in Oregon. We went ahead and made it a requirement of the 25 to 27 grant, just so we can make sure that we actually got our local systems of care to participate. This is a little bit similar to the system reform support instrument that you all might remember. So we'll be able to kind of crosswalk a little bit and see that tool a little bit as like a baseline. But if you remember, we only got like 8 out of 15 local regions to participate in that survey, and there was a lot of limitations to it generally. So we're going to get everybody to participate in the survey, which is great. One region has started collecting data now, and the rest will be kind of staggered in collecting data through middle of October. So by the end of, by mid-February, November, we'll have some complete data from our local systems of care. That all being said, we also would like you all to respond to the survey at a state level perspective. It's virtually going to be the same instrument. And I don't know, Anna, are we going to use like some meeting time or just try and send it out to people? It really would be great if we got all 25 members to respond to it. It takes maybe, 15, 20 minutes. So would love your thoughts about and ways to make sure that we can get everybody to respond. The survey itself kind of asks about 5 major areas, things like implementation of a strategic plan and implementation of system of care values and principles. It talks about like how a variety of services are being implemented, commitment from cross-sector partners. There's kind of like 5 prime categories that the questions are framed in. Cody, do you want to say anything else about it?
The only thing I'll add is that I would highly recommend we set aside some time in meeting to do it. That way we kind of, not to keep everybody, but you just get better responses when you dedicate time. So that would be the recommendation for me. I'm working on building this out in Qualtrics right now. It should be good to go somewhat soon, maybe for a couple meetings from now. I'm not sure which one.
So maybe June, if not.
Christy, you're cutting out.
June should be okay though.
And Cody, how long do you think it would take
To complete the survey or for me to get it ready?
for folks at the June meeting to complete the survey? I just want to make sure that we're setting aside time if we're trying to put it on the agenda.
15 to 20. Maybe 25 to be extra safe, and then or it could lead into a break.
Before break. Okay, got it. Okay. Any questions, comments from everyone else on that, or ways this like sparks, oh my gosh, that's my committee's working on something that should be connected here. We should think of both overlaps or connections. Sort of the point of why we restructured this conversation, this exec meeting. Okay, program and policy. Any of the chairs want to do that, or would you like me to?
I'm about to start driving, but what I will say is that we, have kind of from a strategic standpoint, met with Anna to try to plan out the, targeted agenda topics or areas of focus that we want to have for the next, I think, was it the next kind of 4 meetings or so. We thought about the importance of how are we timing things specific to being prepared for the long session and being able to allow for enough time so that we can be thoughtful and strategic and, set any tables specific to that. We also know that November is coming ahead, and it will be important for us to after the election kind of reaffirm our focus and the work. And so I wanted to make sure that we were thinking about space for that, while also making sure that we're using this space effectively that aligns with kind of the set focus in goals or targets specific to, trying to have impact, for example, around temp lodging, but then looking at how do we, really make sure that that's the space where then the various kind of areas who are represented at the table can speak to the work, while also then thinking about some of the challenges and barriers and then what solutions are. So that's my roundabout update. So Leah, anything you would add?
I think we were also talking about potentially doing some breakout of and Anna, you might want to speak more to this one, but having a legislative work group kind of breakout that focuses on the actual work that we're anticipating pulling into the legislative session.
Yeah, we talked about that because so we have those two bill concepts. One is sort of again, adjusting membership on the council, really basically looking at adding a seat for Medicaid. We've spoken with Disability Rights Oregon, and it is not advisable for us to move forward with expanding the definition of their seat at this time. Anyone who wants to have that conversation is welcome to schedule a one-on-one meeting with me. The other pieces of that are things that maybe make sense to invite some of our LSOC friends in. Like, do we want to specifically connect SOCAC to the local systems of care in some way besides the fact that their CCO contract requires them to do something in alignment with our strategic plan, and our founding legislation requires us to give them some grants, right? Like, there isn't anything real specific that ties us together except these two little mentions that don't actually reflect each other. So that would be a really good conversation to have with our local system of care partners that I think is better done like in a breakout rather than a full committee meeting. The other one is there's some references to like juvenile justice that are inconsistent throughout the statute that folks want to see cleaned up. And again, I think that's like Sonia, Sandra, and Leah having a conversation of like, what does this language what's wrong with the language we have today? What would we want to change for the future? We really won't be able to do that work until we get the bill draft back, because I want to like look at something and edit it instead of have this sort of like nebulous, like we could do this, we could do that conversation, but like here, let's write these words instead of these words. So we are expecting the bill draft back in June or July, and then Leah's sort of on tap as our lobbyist leader to help us figure out how we have that conversation. So she and I would most likely be the ones who are hosting that meeting in that space. Your route avoids. Sorry, Ebony?
Oh, I didn't say anything. Sorry. That was my GPS. Sorry.
Got it. It didn't sound like you, but it had the little green box around your name. And then the only other thing I will say to that is that we have a legislative report that is due in September. That has some specific criteria that need to be met. And so that report needs to be drafted and completed, obviously, in time. And so we can either do that in the Program and Policy Committee space, or we could spin off a work group. So that's something that the co-chairs and I can figure out and make sure we're meeting our timeline. That's all I have. Any questions or comments that sparks?
Just thinking, I guess we don't have a seat for an LSOC on the System of Care Advisory Council. Is that correct? And so that's one of the things that's being considered.
That's something that's been talked about. Thanks for bringing that up, Dan. Something what we talked about with the local System of Care coordinators. Christy and I went down to Grants Pass last week and had a delightful time. And I know that they want that, and I think that there's probably value in it. It does give us a 31-member council, which is like a little bit of a weird situation. And so since the request from the local systems of care, and then how we put that in the strategic plan is to sort of increase dialogue and bi-directional communication. So the idea that we came up with, and Heather, feel free to weigh in if you heard this differently, or Christy, was to create, like in the same way that we have a youth affinity space and a family affinity space, to create a local system of care affinity space where, because we have 2 seats for LSOCs in each of our committees in the same way that we have 2 seats for youth and 2 seats for family. So if the LSOCs were like talking to one another about how they want to be represented with regard to investments in finance, with regard to data and evaluation, like I think that we could really like get a lot more momentum going by creating their own space where they're talking about our work and how it applies to them, and we're talking about how their work applies to ours, and that's how we build that dialogue instead of having a voting member on the council. But maybe I'm just like, I don't know, I don't like the number 31. I can be convinced that adding a seat for them on the council is the right solution instead, or that we do both.
Yeah, the other thing I'd add, and around that idea around having like an affinity space for them, is that we could have a formal rep from that group attending executive committee as well, which might be
And
nice.
then they'd be here having these same conversations.
That's right.
Yeah.
Are there any seats that aren't there some seats where there's like 2 people representing a certain constituency?
Yeah, like the CCO seat has like a rural constituency and an urban constituency.
And then there's like child serving agencies have 3 seats. So there's like Andrew doing IIBHT, right? Me doing treatment foster care. So like those are like different silos in that kind of scope.
And then Allison doing DD.
Allison doing IDD. Yeah.
Oh.
So like same seat, but very different views, right? Or viewpoint of the system. Yeah.
Right.
And there was talk about putting a local system of care coordinator in one of those CCO seats. I think there's also a little bit of a weird dynamic there because not all of the local system of care coordinators are employees of CCOs, and so only some of them would have been eligible for that seat sort of from the jump, like Heather Pasco, for instance, who's in this conversation with us, is an employee of Willamette Health Council, and the CCO contracts with them to do system of care, so like she would not be eligible to be in that CCO seat, and that just like didn't feel fair.
Yeah. Okay.
So think about it, feel about it. We're gonna have time. So if we want to say like, no, we really feel strongly we want to add a seat for them, that opportunity will be available to us at least through February of next year to make that amendment to the bill, possibly longer than that.
Awesome. Thank you.
Yeah. Thanks for bringing it up, Dan. Okay, program and policy data evaluation, membership and development, the one everyone's been waiting for.
Oh, wow. Well, we are actively recruiting our 4 people with lived experience voices. As of, I think this morning, or yesterday, I think we officially developed our 1-pager that's ready to go out about the recruitment that everybody can start sharing. Christy sent it out yesterday in our the digest. If possible, I'll probably get it out to everybody again as a standalone too, just so that they can start sharing it with their networks. So that's going to be the focus of our next couple months, is going to be the recruitment of those positions, the advertising, recruitment, and like trying to get it into as many meetings and groups as possible to really start talking to meaningful stakeholder groups that are possible connection points to the people with lived experience that we're talking about. And Christy sent it out to all the LSOCs today. Awesome. Great. So so that'll be that. And this committee originally was scheduled to meet once quarterly. We decided until August we're going to meet once monthly in order to keep on this recruitment and to get, especially until we get all 4 people with lived experience selected, and then in a new onboarding program, we're going to be meeting monthly to just make sure that we're all on the same page moving forward. And that would be the other thing to really stress to the exec group. Anna and Jasit and I are meeting next week to start talking about how we implement the new onboarding plans that the family council and youth councils have put together, that then we can start ensuring that everybody is getting an onboarding process that matches their experience and how we can really fit them into SOCAC. So lots going on in this space.
Thanks so much, Adam. Adam.
Yeah, Adam. Question: Did did Nick from Morrison reach out to you at all?
I did not hear from Nick.
Okay. I just know that he has interest, and I kind of shared that you would be the person to connect with. Jackie, who sits on the council, was at Morrison, moved to a different organization, but kept her seat. And so I think Morrison is hoping that like a parent mentor would have the opportunity. So anyway, just wanted to make sure you knew that I had offered you up to Nick. If he hasn't contacted you, he's probably gonna. So
yeah, great. Feel free to do that. In the one pager, it says that it gives out my contact information as well as Anna's for anybody to reach out to. Our goal is to spread that far and wide, and really the feedback we got with our last round of when we brought on our family, parent and family reps was that we did not reach enough, or do enough outreach, or maybe not do it. Maybe it wasn't not do it enough, but just it was. It felt short, like a short amount of time in order to meet the amount of folks that we should have been connecting with. And so I want to make sure that we're being responsive to the feedback we received and really trying to reach a broad array of folks in this round of recruitment, so that when people look at it, they can say that it really was not limited to just people in this group or this group. It was really a widespread, wide recruitment.
So just to be really clear, the seats are to parents or caregivers who have parented or caregiven through child welfare or juvenile legal system experiences. So their child was the person navigating the child welfare system or the juvenile legal system, and the parent was caregiving through that time. Or they lost their child to one of those systems, right? Their child was taken away without their consent to one of those systems. And the two youth seats are divided. So one is for a youth with a mental health or intellectual developmental disability diagnosis, or who has received services through either of those systems. And the other is for a youth with lived experience in the child welfare or juvenile legal systems. And anyone who's interested should come to a FAC meeting or a youth affinity space meeting to sort of start learning what is the work, what does it make, how does it make sense. One really exciting opportunity is that there's going to be a shared leadership development training between some members of the Family Advisory Committee and the youth affinity space around just orienting anyone. I mean, there's going to be a limit. It can't be all of them, but probably no more than 20 members of the FAC and the YAS to what does it look like to be on a SOCAC committee? What are the things that we talk about? What kinds of stories are helpful? How do you ask questions? How do you access peer support? How do you know what the agenda means, right? Those kinds of just sort of orienting people to the committee work that they may or may not be stepping into from those affinity spaces. That planning is just now starting with our contracted support people. So Vanessa Broadley, Elliot Hinkle, and Anderson from REAP. I don't know, Annette, if you'll be part of that, or if the youth peer will be a part of that. We haven't quite figured all of that out yet, but really excited about some leadership development training where our lived experience folks will be coming together instead of really operating as like youth and adults in a separate space. I don't know, Annette or Leah, Anderson, if there's anything else you all would add to that. None of you were at that planning meeting, I think, so probably don't have a whole bunch of context to add. Okay. So that takes us to the end of our committee reports, and then we are in affinity space reports. Family Advisory Committee, Annette, Leah.
Hi, this is Annette. Hi, we're going into our fourth meeting now. Attendance seems to be pretty steady. Really glad about that. we have been concentrating on intersectionality over the last few sessions, so we'll be doing that again tomorrow at our meeting at 3:30. So that is happening. Couple of things that are upcoming is on June the 9th, we are having a listening session to discuss school-based supports and services for children and youth. So that's coming up on the 9th. It's an hour-long listening session for families to really talk about their experiences with school-based services. So that is happening. Other than that, every meeting we do mention the opportunity for folks to get involved in some of the subcommittee work. We talk about the opportunities for those seats to come up. So that's been a conversation we've had right along. Leah, is there anything else going on?
No, I would maybe go in just a little bit more detail on the work that the group has done. I'm kind of proud in the short 3 meetings that we've had. We've really moved to a pretty solid, I think, focus on mental health within the system of care, and how that is affecting kind of all the different places that these families are touching, whether that's education or like the, behavioral health spaces or IDD or whatever their kind of connections, all the various connections within the system of care, and how it shows up as it connects to mental health. Because we've been doing these kind of mini surveys at the beginning and at the end of each one of our meetings to kind of capture, what is that kind of core, what are the core things that pop up all the time? And mental health seems to be that one key indicator theme that is tracking consistently. So I'm pretty proud of the group. I'm pretty proud of the team, and just kind of pushing us ever so slightly in every meeting onto this path that this meeting tomorrow is our 4th meeting. And we actually get to start talking about, like, what does it look like if things were starting to look better? Like, what would that look like, so that we can start talking about, like, what does it look like to actually fix it and get it to there? So I'm kind of proud of the family groups. Like, they're really engaging, and they're really, I think they're very eager to see, what's the next step? Like, how do we get there? So that's all I would add.
And I would also add that an overarching theme seems to be that no matter where parents are living, a lot going down in rural areas, even in metro areas. The education piece seems to be that center point where things are really impacting families. So I'm really glad to have the meeting on the 9th. Just seems like no matter where parents are, that is an overarching concern, and starting in that the education centers where kids are. I think that would be it. Thank you.
Just a little quick note on that June 9th meeting. So what is happening there is that, we've been talking as a council at the full council level in the strategic plan about one of our strategic priorities was improving access to school-based services and supports. And so Christy's been doing a ton of research, and she wrote up what we intended to be a 1-pager. It turns out this is a massive topic, so she's done an incredible job, and she's created an 8-pager. And she's going to come to our fact planning meeting, just Annette with Vanessa and I in the morning, to kind of figure out how do we roll this into the planning team space. The idea is that we gather feedback from FAC so we have all this data that Christy's gathered and written up in, and then we gather the qualitative lived experience on the ground, real information that's happening in people's lives. And then we put that together into some information that comes back to the FAC to review it and say, yep, that's what we said. That's how we want it presented. And then goes to program and policy to say, okay, here's what we know from the work the research that Christy's done and the lived experience of our family advisors. here's what's happening. How do we want to choose to take one step forward in this work in the program and policy space? So it's like really cool because this is how we wanted this all to work. And it's the first time we're really trying to like bounce a topic around through the different types of expertises and have it really take on like this really multi-layered, deep context that drives some actual work. So I'm excited about it. I'm excited to hear Annette's excited about it and Leah's excited about it. And so it'll be cool to see if we can make it work in the way that it is working in my head. Further news as events warrant. Jasit, Zafir. Oh, looks like Zafir's hopped out. Do you have a youth affinity report for us?
Hello. I apologize ahead of time if I miss a lot of things. I have been really busy. But the youth affinity space, we're still trying to focus on recruitment. We're very small right now. And we have a meeting, I believe, on Friday. Yeah. It's mainly just focusing on that recruitment and kind of getting off the ground. So if y'all folks have any youth that y'all work with, send them our way, please. I beg you. And yeah, then the joint training with the FAC at some point down the line. That's pretty much it.
Okay, awesome. And I think just to acknowledge we had previously had this dynamic where youth council was much more robust than family committee, and now we have sort of the opposite dynamic, and it isn't because one or the other is more important or one or the other's voices matter more. It's just sort of the impact from having Annette stay on, having Alicia volunteer to stay on and support, and then having Leah and Christina here ready to go. We have these 4 really robust leaders who are taking the reins and rolling with it, where with our youth space, we had Jasid and Zafir, we did not get new youth leaders, so we didn't have that sort of infusion of new energy, and we didn't have to do an orientation and relationship building, which seemed hard at the moment when we started in January, and now is like, oh my gosh, I'm so glad we did all of that work together. Like it just feels so much more dynamic. And then with Joylene being out, the youth council did not get the level of support that they would have otherwise gotten. And so I'm not trying to blame Joylene. I'm just trying to say I want to honor the fact that youth have not gotten the level of support that the family committee had through the beginning of this year. And so there's a really good reason why they're not at the same stage of development, and it's not their fault and they haven't done anything wrong. So, Jasid, I don't know if there's more you would want to say about that, but I just don't want you to feel compared because it's 2 very different experiences.
No, I think I really appreciate you saying all that. It's been a slow process, just even figuring out when to start. So, eager to get that ball rolling as soon as we can. And I think we still have a decent core group of folks that are still engaged. And I'm looking forward to the new folks that we potentially get down the line.
Beautiful. Thank you so much. Okay, so those are all of our committee reports. And so then next is just sort of like, what are we going to do moving forward? I think my biggest priority, like I know that our subcommittees here, I'll show you. Our subcommittees are doing a really good job of planning their, what I'm calling meeting arc. I might have made that phrase up. Here's sort of just so that you can see, and you don't necessarily need to see, but like what the details are. But here is your committee name and your topics by month. So they're like, we have our sort of marching orders outside of membership and development. We'll do that when we meet next week. Sort of what are we here to work on, and are we going to make sure that we're meeting our requirements? And so those are really well planned. The one thing that is not as well planned is what are we doing at our June 2nd information sharing meeting? I have some ideas, but I'm curious what y'all's perspectives are on things that this will be our first sort of work has been happening council meeting. The last one was like, this is, we exist again, right? But this one should be more rubber hitting road if possible. So the June 2nd is the report outs. Maybe it's similar to what we just did and more discussion. And I know we have Kyle coming to talk a little bit about his investiture and some changes happening at OHSU's child psychiatry department. Dr. Jet Milani is finally for real retiring. And that's causing some changes in how they're structured over there. So he wants us all to know that. That's like a 5-minute thing. So what else do you all want on your June agenda? We've already set aside 25 minutes for the survey. It's only a 2-hour meeting these days.
Can I have a few minutes to do recruitment and who like to really highlight what we're looking for our new folks?
Absolutely. How much time do you want? 10 minutes, 15?
What do you think, Jesse? Do you think we could do it in 10?
I think we can do it in 10.
Okay. Yeah, 10, 10,
Give
10,
you
15.
15 because folks are going to have questions.
Okay, great.
Okay, so that's 40 minutes. It usually takes us about 20 minutes to get ourselves rolling. So that's an hour. So we have an open hour. Do we want to just do committee updates kind of like we just did? And then maybe we do a...
Anna, what about, do you think it's important to like get an update regarding kind of just the impacts or like where things are at specific to HR1 and just kind of like, I mean, the federal implications to the system and just like what we know or what we were anticipating? Like, do you think that's relevant or no?
You can't see that. There are many people nodding their heads yes as you're driving, Ebony. Or if you can see that, you shouldn't be. How long do you think that would take?
I think it'd be at least 25 minutes.
Okay. And again, I'm like at least 25, but definitely people are going to have questions and want to discuss that.
Yeah, I think that'd be super useful.
And then that leaves us with about 30 minutes to do quick committee reports and any other announcements.
I like that.
Okay. And then that sets us up on the 15th. We don't have any like decisions to make necessarily yet, or the 16th. What we could do is talk about how we want each of our committees to engage with what we identified as in the HR1 impacts. Sort of what do we want to do as a council and how would we flow that into any of our committees? Like, how do we want program and policy to consider these impacts that we've just been told about 2 weeks ago? How do we want investments in finance to consider these impacts? Right? And does that then adjust any of your committee meeting arcs for the rest of the year? Does that make sense? We should have a strategic planning update. Like, what have we accomplished at some point as well?
Yeah, it definitely makes sense. However, like I've been really involved with the HR1 work internally, and since we are a group focused on youth serving folk, it's really going to be more of the impact on the HOP population moving to open card. So that'll be a big discussion. But then it'll be a lot about parents who will lose access to their OHP, but the youth will still remain. And so we'll have mixed household families. And that's going to be like, so it won't necessarily be the youth impact, but it'll be the impact on the families. I think a lot more of where the discussion will focus.
That's really interesting, Adam, and it makes sense when you say it out loud, but I hadn't really considered it. We've been talking about sort of the family kind of as a unit of measure in our work in terms of like if the parents are suffering, typically children, particularly those with multi-system needs, are also struggling more because their parents are unable to access healthcare or HRSN funds or whatever the thing is, right? So I don't think that's like a problem in terms of that's still our work, I feel like. But if you feel differently, executive committee, feel free to.
I definitely think it needs to be discussed, but I think it'll be like there will be a lot of nuance because our work really focuses on youth and the 0 to 18 population is going to be largely not impacted by the HR1 changes outside of the healthier Oregon population. However, but the families will, again, I already said it, but I think it'll be an interesting discussion.
And I
Yeah,
just think about, and sorry, because I'm driving, sorry if I cut. I think too, which there's some things hard to predict at this point, but like thinking about as we have limited funding and have to make reductions to, the funding that goes to CCOs, what are there implications around reduced funding for, let's say, ABA. And so I think like just, what I will make sure we talk about are just any considerations specific to services as a result of needing to kind of right size to, what the future holds, if that makes sense.
Makes sense.
Yeah, I'm sorry, Anna.
Don't be.
I was just thinking, I've been tracking it similarly to what Adam just said, but I'm just curious, just off the top of your head, do you have an analysis, having thought about it, around, because our assumption is that if the parents fall off the Medicaid rolls, then the kids are less likely to be enrolled as well, even if they're eligible, just because of the way those things kind of go. So I don't know if you know something more, or what makes you think that, even though the kids are eligible, that they're going to stay on if their family rolls off.
Yeah, it's going to all come down to how people are notified, how they continue to be engaged in being able to know the process to do the paperwork. So yeah, there definitely will be a loss to even those youth under 18, even though they'll still technically be eligible. A lot of people will probably fall off the rolls even with them being eligible for it. So you're right on it.
I mean, obviously we've got lots of worries for everyone, but that's what I've been thinking.
Okay, so for June 16th, I have 20 minutes, kind of welcome, settle, roll call stuff, because we're in person. Things take a minute for everybody to grab their lunch, all of that. 40 minutes for HR1 impacts conversation, and then how maybe 20 minutes for how does this impact the work of the subcommittees. So what do we want to do with that information? I see you, Allison, just a sec. And then the rest of it being maybe some strategic plan implementation and what have we accomplished already? Because I feel like it feels like we're not doing anything, but things are actually happening. So I want us to actually take a minute to mark the progress we've made in 2026. And maybe if we have time, broadcast a little bit of here's what our committees are planning on working on, so that folks can kind of wrap their heads around, we do have a plan, and the strategic plan is driving the committee work, and it's really complex, but it will make sense if we keep if we keep explaining it to each other and asking questions. Allison?
So I just wanted to, when you said kind of the impacts of HR1, obviously there's the direct impact on healthcare access and access to OHP, but then there's also the down kind of river, challenges of if there's less money in the system, long-term services and supports that are under our community-based waivers are also potentially going to be impacted. In fact, they're looking at potentially taking away parental income disregard for IDD kids, for example. So I would just want to raise that when we're talking about HR1 impacts, that it's not just access to the Oregon Health Plan, but it's kind of generally speaking, I think there could be, and I know we all know this, but want to make sure that we don't forget about all of the grants that don't have any sort of matches that may be up for cuts. It's so broad that I think I just don't want to forget those other pieces.
Okay, so that's really important, Allison. So 40 minutes for HR1 impacts, and what I put here just to keep us, as we're sort of developing this for June 16th, what do we want to do about it as a council? The conversation will need to focus on family instability, at least to some extent, with the healthier Oregon population, adults moving to open card or losing coverage, unstable access to care, funding cuts for programs and CCOs, implications of funding cuts to specific services that have been considered, and other impacts like removing parental income disregard for children with IDD. Does that feel like sort of it captures the conversation? And then maybe what we do is that we kind of prime that as we're getting ready for the OHA report on the 2nd of what are they thinking of the impacts are. And we're also asking folks to listen for how do you feel like this may affect you. We're going to talk more about it on June 16th. So take some notes, think about it, right? So that we're coming back to, what is Allison's perspective on this going to be really different from Adam Peterson's perspective on it. It's all super important. That's why we have these perspectives at the table. Okay. Okay. Then we have planned all the things that need to be planned. Are there any announcements that folks want to make? Or staff that I was supposed to make that I forgot?
One thing we missed in the agenda was what to do for Paige Snow's EP SDT population, but I think Anna and I decided on that kind of that it might be both a data evaluation and program policy. So we didn't really miss it on the agenda. Just decided that everyone deserves to hear that report.
And then Christy put, and she's not here anymore. She had to go to she's having some drama with her school. She put in the agenda, OHA can come to a September 1st meeting to talk about CCO procurement, but we don't have a September 1st meeting. So I don't know if she's talking about October or something else, but I will follow up with her. I think we've been wanting to understand more about CCO procurement for a long time. So does anybody want me not to follow up on that and try to get them into a meeting when we can get them in? Okay, then I will do that. Oh, we have our little post-meeting survey. It is really important that you actually complete it. I know it feels rote, but the only way we can gather data across time is if people provide data across time. Oh, thanks, Adam Peterson. I wasn't looking at the chat. So one more thing, announcement to make. Adam, do you want to make the announcement about our new governor-appointed council chair, or would you like me to make it?
I'm not sure which Adam you're talking to right now, because Adam
Rodakowski.
Okay.
Chair Rodakowski, would you like to make an announcement?
Yeah, sure. So the governor's office has appointed Anna Day, who's the executive director of Oregon Community Programs, as the incoming chair for when I term off at the end of the year. Anna has been at Oregon Community Programs based in Eugene for like 20 years, I think now. She started as a therapist there. She's a licensed marriage and family therapist, LMFT. Has worked her way up and is now the executive director there. They operate Treatment Foster Care Oregon, which is an evidence-based foster care model that grew out of the Oregon Social Learning Center and social scientists Patty Chamberlain and Phil Fisher, who are like foster care juvenile justice legends in the nerd game of social work. And then they also provide outpatient services like IIBHT and other mental health services. So she has kind of this dual understanding of both the foster care system, higher levels of care, and also OHA behavioral health. So she's also just a lovely person. Like, y'all are gonna like her a lot if you don't know her already. She's a lot smarter than I am. She's a lot more measured in her words than I am, and she's just fantastic. So I think she will be fabulous.
So, and she will be taking Adam's actual seat on the council, but Adam is with us. Adam Rodakowski, to be very clear, is with us through the end of this year. His term ends on January 1st, 2027, and Anna's will start on January 2nd, 2027. But she's going to start coming to some of our meetings to be ready, because taking over as chair from a vacuum is not the way that she wants to start this relationship, right? So she's gonna start working with Adam and I in our weekly supervision conversations, and then depending on how her schedule works, I think she can't be at the June 2nd meeting, but she'll be at all of our other full council meetings, and then she'll hop into some of our committee spaces and really try to like learn the council before she comes on to start being chair. So you will see more and more of Anna Day, I think starting in July when her term as chair of the Oregon Alliance completes itself, and then she has some extra time. She's just looking for more volunteer opportunities.
Do you know, is she gonna also step down as the chair of the Behavioral Health Committee too?
That I don't know. Oh, but that's a good question, Adam. I do think that I'm going to be stepping into that seat. Adam Peterson is currently the SOCAC's representative on the Behavioral Health Committee. And it's a bit of a burden for him to be in both spaces and try to be the communicator between SOCAC and BHC. And so if I'm that person, I can bring those conversations here and our conversations back to the Behavioral Health Committee, and I think I'm a little bit better of a spoken hub than one of the members. So that's also happening, but I don't know if she's going to stay there or not, Adam. That's a question any one of us could ask her. And if there's anything else, feel free to speak up. Otherwise, please complete your post-meeting survey with the 15 minutes of your life that you're currently getting back from this meeting ending early.
See y'all.
Thank you.
Thanks, everybody.
Thank you.
Bye.
I was just going to say, I really appreciate what was lifted up about the HR1 conversation from Ebony, and I look forward to that conversation. Have a good one.